Hello everybody, welcome to the Thursday edition of Video Clips. According to new guidelines from the U.S. Preventive Services Task Force, the most effective treatment for obesity is intense multi-component behavioral therapy. Boy, there's a shocker, right? Who'd have guessed, right? Effective interventions include things like dietary counseling, increased exercise, goal setting, and self-monitoring strategies. All great big surprises. We definitely need more scientific reviews to tell people how to lose weight. The task force also looked at the efficacy rates for 5 obesity drugs approved by the FDA. Obese individuals who use the medications in combination with some of these other behavioral strategies were better off and more likely to maintain their weight loss for 12 to 18 months than those who used the drugs alone. The task force noted that there were few clinical trials that evaluated obesity drugs, and these trials often use selection criteria which should not have been allowed. So, for example, often the people were forced to demonstrate that they would adhere to the medication schedule and that they were capable of losing weight before they were enrolled in the trial. So you take a bunch of people who've already shown that they can lose weight and then you put them in the trial. That shouldn't be allowed, but it is. But what it means is that if you're looking at a trial for a weight loss drug and it shows that it works, it may not work in the general population with all of these people so carefully screened to participate. And the task force also noted that there are harms associated with taking the drugs that haven't been well studied. So I do get questions about these drugs, and people say, well, it helped me, can I continue taking it? And of course, I'm all about the informed decision making, not telling you what to do. But I have done my own research on these drugs, and I thought I would share it with you here. Efficacy rates and side effects and the whole 9 yards. And this is with every advantage possible, all right, what I'm going to tell you. They're pre-screening the people, they're making sure they can lose weight already, and here's what you end up with. So Orlistat, which has, the brand name is Ally. It used to be a whole lot more advertised than now, but anyway, it's been shown to result in 6 pounds greater weight loss than placebo at 12 months. Wow, I mean, it just blows you away, right, that efficacy rate? And that's when we're picking people who already know how to lose weight. All right, it's approved for use by both children and adolescents too, and in return for this 6-pound weight benefit or advantage, side effects include severe liver damage, fecal urgency or incontinence, flatulence, liquid stools, oily spotting, abdominal cramping, and reduced absorption of vitamins. All right, so you really want to do that to kids and children and adolescents. It just blows your mind, right? Less than 1% of patients continue to take the drug after 1 year. Not surprising. As it turns out, pooping your pants in the car, not that much fun in exchange for 6 extra pounds of weight loss. All right, so we'll move on to the next one. Kismia is a combination of the appetite suppressant phentermine and the anti-seizure migraine medication topiramate. Now, this drug suppresses appetite, increases the feeling of fullness, makes food taste less appealing, and increases metabolism. So it has like a speed type effect. Good news. According to data posted on the drug's website, at 56 weeks, patients can expect to lose 24 to 32 pounds, which is about a pound a week. You should be able to do that without this drug, actually. Now, the side effects include birth defects, you can't take the drug while you're pregnant, increased heart rate, suicidal thoughts or actions, permanent vision loss, glaucoma, sleep disturbances, issues with concentration and memory, metabolic acidosis, central nervous system disorders, kidney stones, numbness and tingling in the hands, feet, arms, and face, constipation and dry mouth, and seizures when you discontinue taking the drug. This is all for an extra pound of weight loss per week, or a pound of weight loss per week. Now, the Belviq website states that taken along with diet and exercise, the drug can help, quote, some overweight or obese adults with weight-related medical conditions to lose weight and keep it off. Now, here's the quote. I always go to the drug company's website because I figure they're going to tell you the best news about their drugs. So it's actually posted on Belviq's website. Quote, it is not known if Belviq, when taken with other prescription over-the-counter or herbal weight loss products, is safe and effective. It is not known if Belviq changes your risk of heart problems, stroke, or death due to heart problems or stroke. We have no idea. It's approved by the FDA. We don't know, but you should take it. Side effects of this drug, birth defects, you can't take it while pregnant, life-threatening symptoms if taken with medications for depression or migraines or even the common cold, valvular heart disease, memory loss, depression, hallucinations, suicidal thoughts, low blood sugar, painful erections, and decreases in white and red blood cell count. In 2 large clinical trials, Belviq helped only 24.5% of patients to lose 5% or more of their body weight, which means that over 75% of patients lose less than 5% of their body weight while risking this entire litany of side effects. All right, so are we crossing them off the list here? Like, you might have been thinking about it, but now not so much. I'm not done, by the way. Tenuate is an appetite suppressant. In one double-blind placebo-controlled trial, patients who took Tenuate lost more weight at 6 months than those who took placebo, but at 12 months, no difference at all. Useless, in other words. Use of this drug involves a very long risk of side effects, which include heart disease, increases in convulsive episodes in epileptic patients, dyskinesia, blurred vision, nervousness, dizziness, tremor, cerebrovascular accidents, vomiting, diarrhea, rash, impotence, and leukopenia. All right, so for a useless drug, that's a lot of risk, I think. And then one that you might be seeing on TV a lot right now is Contrave. It's a new drug for weight loss. It's a combination of an antidepressant and a drug used to treat addiction, neither of which is approved for weight loss, but apparently the combination together is okay, I guess. The website states, quote, "The exact neurochemical effects of Contrave leading to weight loss are not fully understood." Okay, this is disconcerting to me. No one, including the company that makes it, knows how it works. The company hypothesizes, they have a theory about this, that the drug reduces hunger and controls cravings, which leads to weight loss, but then it's only supposed to be used with a reduced calorie diet and increased physical activity, so it should lead to weight loss no matter what. You know, I think you could probably do without this drug. Now, the side effects for this one are perhaps the longest list of all. Increased risk of suicidal ideation, seizures, risk of opioid overdose, severe allergic reactions, increases in blood pressure or heart rate, liver damage, visual problems, depression, serious neuropsychiatric events when used for smoking cessation. Apparently you can use this for smoking cessation and weight loss too. Great. Agitation and restlessness, panic attacks, insomnia, irritability, depression or aggression, anger, violence, dangerous impulses, mania, chest pain, trouble breathing, swollen lymph nodes, painful sores in the mouth or around the eyes, yellowing of the whites of the eyes, hypoglycemia in patients who have type 2 diabetes. I won't even read you the whole list. In fact, it goes on, and then at the end the company says that these aren't all the side effects of Contrave, and it's not known if the drug increases cardiovascular mortality. So here's the summary. This is a drug that the maker doesn't know how it works. Nobody knows. But if you take it, you get this very long list of side effects. And but very few studies show that it actually works. For those taking drugs as part of a lifestyle program, this one or anyone, the average weight loss is someplace between 3 and 9% higher than those taking placebo. And I think if you put this data in front of most people, nobody in their right mind would take these drugs. Okay, full disclosure would eliminate most of the terrible stuff we do in healthcare. Well, if drugs are not the answer, what should you do? Well, now we're going to go back to this whole idea, crazy idea, behavioral modification. You have to change what you eat, right? I'll never forget a good friend of mine who lost like 50 pounds. I hadn't seen him for a long time and had dinner with him and his wife. I said, gosh, you look great. What are you doing? He goes, I discovered this amazing thing. I eat less. It works so well. It's just shocking. I never tried it before. All right, so here's where we can get some clues. The National Weight Control Registry was started in 1994. It's the longest prospective study of long-term successful weight loss. The registry is currently tracking over 5,000 people. They're all at least 18 years of age, but their average age is older at 66. The average weight loss is between 30 and 300 pounds, and the average maintenance is 5.5 years. Now, if you take a look at the success or failure rate, would be better way to put it, of weight loss programs, 5.5 years of maintaining weight loss is really a pretty amazing thing. And here's what these people say they do. Most said that they eat a low-fat diet and they engage in high levels of exercise. Shocking, right? 90% said they exercise an hour a day or more. Women burn an average of 2,500 calories a week exercising. Men, it's a little bit higher at 3,300 calories a week. Most reported exercise activities were cycling, aerobics, walking, and running. Outside of formal exercise, the people are much more active, the registry participants much more active. Most eat breakfast, 80%, and the breakfast eaters were almost all more physically active than the non-breakfast eaters. Their diets are remarkably consistent throughout the week. They don't do this cheat days stuff and they don't fast. They monitor themselves carefully, with 75% reporting that they weigh themselves at least once a week to keep themselves on track. What's perhaps most striking, I think, is that these people have never met each other, but they practice very similar habits and use similar strategies. These are strategies that can be taught through behavioral counseling and are far more effective as drugs, just as the task force said. So the secret to weight loss is the stuff you already know to do. Now some of you are saying, I know to do it, I've tried doing it, it hasn't worked out so well. We have a marvelous weight loss program. Marvelous. We have a wonderful registered nurse who is a specialist in behavior modification, who teaches our interactive classes. We have some online videos for you to watch, one-on-one appointments. If you're serious about doing this, we can help you do it. But what I have found is most important is people have to really be committed. It's like anything else that you're going to do. And I've talked about this on video clips before. You know, everybody's all excited about stuff when they first sign up to do it. But it's only if you follow through that you actually get success. I mean, have you ever known anybody who says, you know what, I'm going to run for the U.S. Senate, and then they declare their candidacy and get all their forms filled out, and then they just sit down and wait for the election? No, they go out in the campaign, they do stuff. I mean, this is how you get something done. You ever known anybody who goes through all the trouble to set up a business and lease an office and then just, what the heck, I'm kind of bored with it now. You know, you don't let yourself do this kind of thing with other things that you endeavor to do. So I promise you, whether you do it with us or you do it with somebody else, if you really treat this like it's something that's important to you, you'll be amazed at how much more successful you'll be. And I don't think I'm telling you anything that you don't already know. I'm just giving you a friendly reminder, all right? Well, as usual, first of all, hit the subscribe button if you are not already a subscriber, and do pass this on to anybody else who you think would enjoy watching it. I'll be back to you next week with more news.